8 minutes after 1 o'clock on this Thursday afternoon. Thank you so much for staying with us in conversation on Power Lunch on Power 98.7. Now we're talking. My name is Faith Mangope, in your company until 3 p.m. Simple. That means lines are open on 0861 987 000. That's where you can find us in the studio. Alternatively, 0833037093 at Power FM 987. That is the Twitter handle. At Faith Mangope is where you can find me. And of course, the hashtag, as always, is hashtag Power Lunch. Let's turn our conversation to something a little bit much more humanistic, right? And more than anything else here, this is proper sharing. Another one of those intimate conversations that you and I always have together during the time of 1 and 2 p.m. And one such a conversation today is no different. In fact, I'd like us to look about the unspoken, ugly truth about pregnancy. The unspoken, ugly truth about pregnancy. You know, as soon as a woman is pregnant, a lot of things that get said to her is that you will glow. You will have the glow, and your skin will be right, and your hair will grow, and your fingernails will grow, and you will just be in this bubble of absolute pure bliss. But how many times is it true? And what makes it untrue for many people? And I'd actually love your experiences from the get-go. If you are such a lady that went through what you would term as an uncomfortable pregnancy, an ugly pregnancy, will you share your experience with us? I don't mind you remaining anonymous. We can even give you an alias, so as it were, on 0861 987 000. If you went through that ugly pregnancy, you know where your skin gets darker? Your pigment, the skin pigmentation change. Did you ever experience the pigmentation of your skin changing? You know the one where your nose gets bigger? And this one hurts the most, the nose. But you know when your nose gets bigger? That one, where you are 6 months into it and you can't wear shoes anymore and you have to wear slippers, and they don't tell you about the fact that you're going to be living in slippers for the remainder of the 3 months. You know the one where you are constantly constipated, but yet they don't tell you that you're going to be constantly constipated. That one. And the ugly truth, the other side of the glow. That's what we're removing the veil on. And please, I'd love to know your pregnancy experiences on 0861 987 000. The hair loss. Here's another one that also happens. A lot of women lose their hair. And one wonders, do you ever gain your hair back? Never mind the body, just your hair goes. Let's talk about what happens behind the veil, behind the glow, the ugly truth about pregnancy. And I'd love your experiences as well. Dr. Kwaw-Asante, obstetrician as well as gynecologist and author of Pregnancy Related, a woman's health-centered narrative, joins us now. Dr. Kofi, thank you so much for your time this afternoon. Welcome to Power Lunch.
Good afternoon. Thank you so much for having me.
Dr. Kofi, maybe you can help us understand and unpack pregnancy really. Help us understand this phenomena of life, right? Sometimes there's the glow, right? You look at the woman and she looks as though she's walking on a bubble of marshmallows and candy-scented delight, right? Which is always pink and blue and white.
Yes.
And then on the other side of it, you've got a woman who cannot wait and sometimes it translates between my baby to the thing to come out, because they've gone through the most.
Yes.
What informs that? You know, what informs the disparities, and I'm going to say this, the inequalities in pregnancy?
Well, I think the first thing we need to understand is that pregnancy is a very unpredictable state. That women can find themselves in. And it's unpredictable in the sense that it's controlled mainly by hormones, which as a woman your body would naturally produce. But the truth of the matter is, when your body produces hormones, there's no telling as to how your body is going to respond to that hormone production. So some women would respond positively, where they'll get the glow, they'd get the nice hair, the nice skin, etc. Whereas other women would actually experience the opposite side of this, where, it would actually maybe give them acne, it would give them excessively oily skin, and it would give them, the excessive morning sickness that they sometimes experience. So it all depends on exactly how your body responds to the change in the hormone production that is associated with pregnancy. And unfortunately, that's something that we can't predict from the get-go in pregnancy. It's something that as the pregnancy advances, we see how your body's taking to it, and then if it's really bad and it's really affecting you negatively, then there are some things we can do to try and make it a bit better. But predicting it is very hard because pregnancy itself is a completely unpredictable state.
Why is it? Yeah, Professor Dr. Kofi, why is it that it's unpredictable? I mean, a baby's a baby is a baby is a baby. Is it because two hormones are not the or two people are not the same, and the hormones that are within them? So as much as I can have, and is it determined by the level of estrogen or testosterone that I've got in my body? I mean, versus the amount of estrogen and testosterone another woman has in her body?
Yes. So remember, to take an example, the contraceptive pill is something that most women use.
Yeah.
But definitely the two experiences, the experience of two women on the same contraceptive pill will not be the same. Simply because their body dynamics and the way the body treats the contraceptive once it's ingested is completely different between the two women. So the idea is, for example, your weight, how your body metabolizes the medication or the hormone, all comes into play as to what the side effects may potentially be. So with pregnancy, it's no different, because pregnancy is like a state where now your body has now got an injection of this hormones, and now your body has to mount a reaction towards this hormone surge that it has now developed, and that hormone surge, that reaction to that hormone surge, unfortunately would then cause the different reactions that different women will experience. But I mean, it makes it very hard because, I mean, as individuals, women are different, and women are different in the way that their body metabolizes or breaks down certain drugs and certain hormones, and different ages of the woman as well also comes into play. With the older woman generally finding it more difficult compared to the younger, more fitter or more healthier women. So it also boils down to that as well, as to how it is your state or your health was before you actually fell pregnant. Because depending on the state that you were before pregnancy, it would actually add to whether or not your body actually tolerates pregnancy better, or actually pregnancy worsens whatever conditions you may have had or whatever state you were in pre-pregnancy.
So my pre-pregnancy, is it prenatal, would it be, or is it pre-pregnancy?
Pre-pregnancy state, yes.
Pre-pregnancy state, right? If I'm a healthy body who doesn't have acne, who doesn't have, and I'm slightly active, maybe I don't go to gym, but I'm slightly active, would that be an indicator of how I will carry? or can the miracle of life switch up on me?
It can be an indicator, but it's not certain, because, like I said, it's a shock to your system once you become pregnant. So that shock to your system is something that your body now has to say, okay, we've been shocked. What can we do we need to mount a reaction against the shock? And it's in that your body mounting that reaction that these adverse effects can develop, or in some instances, positive effects can develop. But it's all about your body's ability to tolerate the sudden shock that has been imposed upon it by virtue of you being pregnant. And it's possible that, when you're in a good pre-pregnancy stage, you're healthy, you're gymming, you're of a good weight, etc. You basically have a good, healthy lifestyle and a good, healthy medical background. There is a good chance that during the pregnancy, this will continue and might actually be for the benefit of the pregnancy and for the benefit of you in terms of how your body reacts to the pregnancy. So definitely a good pre-pregnancy state would, to some degree, assist as far best as possible to actually put you in a good pregnancy state when the pregnancy actually does happen.
Sure. And I know that we're going to have people that are going to be phoning in to ask you questions, and we are going to open up the phone lines. Dr. Kofi Kwaw-Asante, who's an obstetrician, gynecologist, and author of Pregnancy Related, a woman's health-centered narrative. Did you also miss out on the glow of life where you felt as though you were walking on bubbles and balloons, and all of a sudden you discovered that your pigmentation was darker while you were pregnant, that your feet had swollen up 3 times the size that they were, that your weight gain was more than what is the recommended dosage, that your hair started falling out, that for some odd reason you started getting back acne, that you were sweating more, all the things that are not related to the glow. We're talking about the ugly truth about pregnancy. And if you've ever gone through this experience as well, ladies, if your pregnancy was not so nice and not so magical and not so pretty, can you share on 0861987000? Remain anonymous. That's okay. What we're doing today is just making sure that we're all not alone in this. Let me go straight to the phone lines. Buntle in Rosebank. Hi, Buntle.
Hey, Faith, how's it?
I'm very well, thanks. And you, Mama? What happened?
Good. Listen. You know, I loved my pregnancy. The first 2 trimesters, listen, they were like heaven. But I feel like my eyes only got opened after I'd given birth. You know, I used to now look at pictures in my 3rd trimester, and I was like, who on earth is that, hey? My goodness, I feel like the pigmentation on my neck and my face, I was 2 different people.
Wow.
My nose was like, let me just expand so you can take in more air. And I was just like, oh my gosh, what is happening? And then though, so while I was pregnant, you know, I had really good hair. But after the fact, my hair just kept on shedding and shedding and shedding. And I was like, oh my goodness, what is happening? So now I actually have one question for the doctor.
Sure.
And I am still working on this. So I went up a whole shoe size. How do I bring that back? Can I ever get back to my normal shoe size?
You went up a
I
shoe
think I wear
size?
skateboards now. I really feel like I wear skateboards, I'm telling you.
So the thing about the shoe size is, you know, when you're pregnant, particularly in the 3rd trimester, as you say, your eyes open up, is that a lot of changes happen in that trimester. And one particularly noticeable change in that trimester is the amount of water retention that many women develop at that stage. And the water retention results, and then it usually accumulates in your thighs and in your ankles and in your feet. And from that stage on, that's something that happens right up until delivery, and even it usually worsens after delivery to the 6-week period, the 6-week postpartum period. So after the 6-week postpartum period, we usually expect this to actually start getting a bit better. But things like, you know, elevating your legs when you can, and, you know, being more mobile in the postpartum period can actually help alleviate the swelling that develops in the 3rd trimester in particular. Unfortunately, it is a part of, you know, the normal journey of pregnancy, and it's not to say that if you do actually put on the excess swelling or the increase in shoe size in the 3rd trimester, it doesn't necessarily say that there's something wrong with you or your pregnancy. It's just a normal physiological part of the pregnancy. But losing that weight or that shoe size at the end of the pregnancy is something that, you know, you have to actively work towards. Generally, you know, elevation of the foot, and if it doesn't work, then we might have to look to see maybe there might be a secondary cause as to why the swelling is persisting beyond the time that we expect it to. But usually, you know, after 6 weeks, it should help start subsiding.
Yeah, thanks, doctor. But now here's the problem. So my feet aren't swollen anymore. I just feel like they've grown longer. Like, my feet are not swollen, but I just do not fit in the shoes that I used to wear.
I'm not laughing at you, Buntle.
Don't laugh, Faith. You know, it's not funny. Okay, it is funny. Let's laugh, eh?
I'm so sorry. Doc, help us out here.
But this is such a fascinating conversation here. And I think these are all the things they don't tell you.
They really
don't.
don't.
Good they don't tell you. Otherwise, you'd never do it, I suppose.
You would never fall pregnant. No, you would never ever.
How do you drop a shoe size, though, then, Doc?
Sure. That is a hectic one, hey? Because remember, pregnancy is a state of growth. And it's growth in all aspects. It's growth for your baby, and it's growth for you as a mommy as well. Physically, psychologically, emotionally, there's a lot of growth that happens. So, I mean, if that growth is encompassed in, you know, a shoe size or a dress size bigger than what you were, it's a part of that growth. It's just some of these things you can actually actively work towards. A shoe size, though, that's a different ballgame altogether, hey? But definitely, you know, some of these changes are things that we can work towards, you know, with the help of other healthcare specialists. but I mean, dropping a shoe size is something that's it's a lot to ask. It's a tall order. I'll be honest with you. Hey,
I can imagine, definitely. Are you also counted in the ones that did not have the best of pregnancies, where your hair started falling out, you got the acne, you got the pigmentation, you got the nose that went bigger, you got the feet that I love it when I see women dress up in slippers. I swear, it's like my favorite thing. You couldn't wear heels anymore. You just got the gas, and we'll talk a little bit about that in a while, Doc. You got the gas, you got all the not so nice stuff that people don't tell you about pregnancy. Are you to be counted in that list? 0861987000, as we all share our stories. Noma Sonto Ngema. Oh, Noma Sonto, I hate you. Look at how nice you look. She says, I look good, Shem. You really do, Noma Sonto. You really do. But I had gestational diabetes as well as edema. Closed shoes only fit for 7 minutes, and then my feet swell up. I couldn't enjoy cake, fruit, chocolate because my body couldn't break the sugar down naturally. Oh, shame, man. Dipufuma saying that when I met the mother of my child, I didn't have much love for her. It was only after her pregnancy ugliness that made me love her dearly. I guess that's where I experienced power of God in women. Women, accept yourselves. You are world creators. Success Male, who's saying, your faith. I became ugly with my son's pregnancy. I had a big nose. My kids today say that the photo was one of the grandmothers of the family. 0861987000. You're also the one that did not experience that glow. Mbali in Randburg. Hi, Mbali.
Hi, Faye. How are you?
Why do you breathe so heavily with this conversation?
I'm actually crying because
Are you
I'm
crying?
a 44-year-old. 44. I became pregnant at 44.
Yeah.
So all the things the doctor saying, I mean, it was against all odds. And it was one of the ugliest pregnancies because I was told my baby is 1 in 20. So I was carrying, not knowing whether I'm carrying a human being or I was carrying. So I had to face all the way through the pregnancy. But the worst part of my pregnancy is when I became constipated at work. And I came out and I was crying. And everybody was like laughing at me. Why am I crying? Thought that is a pregnancy hormone. While I've got this thing stuck at me that doesn't want to come out.
Oh, shame.
I had to go back to the bathroom and try. And say, even now, after the pregnancy, 3 years, I'm still struggling of
going to the bathroom?
From that. Yes, from that.
Wow.
That's the ugliest part of the pregnancy. A 44-year-old woman was pregnant, first child, and then that happened. I'm scared to even to try the second one.
How's baby, though?
The baby's fine. It's 3 years now.
So you look at it and you're very appreciative and grateful that you've got baby. But you went through it.
Yeah, I went through it. I'm okay. I am okay.
Sure. Dr. Kofi, constipation of this nature is very severe. I mean, are you able to, I mean, what can you just inform us around what causes constipation in pregnancy and what is normal constipation and not normal constipation? And to Mbali's point, are you able then to have a normal bodily and bowel movement post?
Afterwards.
Yeah.
So look, the idea with pregnancy is, like I said, it's a state of growth. And one of the organs that grow in your body when you're pregnant, obviously, is the uterus, which houses the baby and the pregnancy. So as the uterus begins to actually grow and pick up weight, particularly in the second and third trimester, you'll find that growth of the uterus starts to put pressure on the surrounding organs around it, particularly posteriorly to the uterus. Then we're talking about the rectum, where the stools are housed. So what happens is, as the uterus grows, then the uterus puts more pressure on the rectum, and that results in the constipation that most women feel, particularly in the second and in the third trimester. It's something that once the delivery has happened and that weight has been alleviated, that should spontaneously resolve within the postpartum period. However, if beyond the postpartum period we still get that, the episodes of constipation, then there might actually be something else that could be causing that constipation. For example, if your uterus has got what we call uterine fibroids, so these are growths that are usually attached to the uterus, then you might be constipated chronically even post-delivery, because the fibroid will still be exerting pressure on your intestines, and therefore still, causing you to have constipation. So if constipation goes on beyond the 6 weeks postpartum period, then it might be worthwhile to have it checked out, usually by a general surgeon, maybe have a colonoscopy or just have a consultation with a general surgeon so that they can exclude any other causes. Because in pregnancy, we can attribute it to the pregnancy and the weight gain in terms of the uterus and the baby. But once that has been alleviated, it should spontaneously get better. But if it doesn't after the 6 weeks postpartum period, we would need to have to investigate it a bit more.
Mali, you got that? That might mean that you might have to just go get a checkup.
Thank you very much. Oh, thank you.
Thanks, Mbali. Thank you very much. Priscilla in Four Ways. Hi.
Hi.
Yes, Mom. What happened?
Yo, fuck going on. So, honestly, guys, pregnancy really dragged me by my neck.
Yeah.
So, the first trimester, I had what we call hyperemesis, where you overly vomit. Like, I vomited all throughout my first trimester. And on top of that, there's emotions. It was so horrible. I could not eat anything. I could not put anything down. I had to go to the hospital where they gave me a drip, and the first thing I wanted was a burger. Even that burger lasted, for a while, and then I got better because I was towards the end of my first trimester. Second trimester was great, no problem. Third trimester, my face was so swollen. It was so bad. My lips, everything was just swollen. I looked like a completely different person. Till today, my mom is like, you look you look so different. And then after giving birth, that's when I think also postpartum depression, for some reason, pregnancy, please, I love my daughter, but it really, really traumatized me. Then I had what we call my hand started giving me a problem. I don't know what we call this thing, Carpal Tunnel post-pregnancy, whereby your hand feels numb. Till today, I am still affected by that. My whole left side at this point sometimes tends to feel very numb.
Sure. Priscilla, hold your thoughts, because you've mentioned different aspects of it, and I want us to be able to unpack it with the doctor. Dr. Kwaw-Asante as well joining us. And as I said, I'll take your experiences on 0861-987-000. Are you one of those ladies who did not experience the glow? Let's share. Top us one.
0861-987-000.
It is 26 minutes to go before the top of the hour. We're speaking about the unspoken ugly truth about pregnancy there. What are some of those symptoms that you went through? I'd love your experiences on 0861-987-000. Thank you so much, ladies, for sending me your pregnancy pics. Some of you are really holding on nicely with the glow. You've got Glow Getter there, which is saying that I will sit this one out. I was blessed with the glow. Now I'm told the second time I may not be that lucky. She's looking absolutely fabulous. And keep sending them. I love it. What are some of those experiences that you've gone through? You want to share on 0861-987-000, as we're still with Dr. Kwaw-Asante, who's an obstetrician as well as gynecologist and author of Pregnancy Revealed, a woman's health-centered narrative. Dr. Kofi, we're dealing with Priscilla, and I know I'm feeling really sad. I know you've got a consultation soon, but Priscilla was speaking about how you got very sick, hey, Priscilla, and you couldn't deal, and you had to carry it for about, and then afterwards as well, you also got swollen. Yeah. I had carpal tunnel post-pregnancy. It's like numbness and nerves of the hand. Sure.
It's horrible.
Sure. Dr. Kofi?
So just to touch on the carpal tunnel syndrome, so as I mentioned, there's a lot of swelling that happens in the third trimester. And one of the places that the water can accumulate is actually in your wrists. And what happens is when it accumulates in your wrists, then it puts a lot of pressure on that joint and the nerves that supply that area. Then it gives rise to what we call the carpal tunnel syndrome. So that is something that naturally should also alleviate itself within the 6 week period. But ideally, if it doesn't, then you need to seek counsel for that to see, what they can do in terms of physiotherapy and other treatment methods for you. But I think she summed it up very nicely as far as pregnancy is concerned. How she said, first trimester she went through the hyperemesis, and then second trimester was bliss, and then third trimester became rocky again. So that's exactly what pregnancy usually for most people is like. The first trimester is like, if you compare to the like I said in my book, I compare to the flight of an aircraft. The first trimester is like takeoff. It's a bit shaky. You're holding onto your seat. You're not sure what to expect, and then when you reach cruising altitude, you've hit the second trimester. that's when most women would actually love their pregnancy in terms of the glow, there's fetal movements that kick in, your tummy starts to show, you really start to actually enjoy the pregnancy for what it's really worth. Then third trimester hits, and then the swelling starts happening, the tummy is now excessively big, and there's a lot of pressure down there in terms of the baby putting, the uterus and the baby putting weight on your pelvic bones, and then, the feet are swelling. So it's a very uncomfortable stage, and that's likened to landing. When you're in an aircraft, also very unpredictable type of state during air flight. So I think what she went through is actually what most women would actually go through in their pregnancies, as far as first, second, and third trimester are concerned. But to touch on what she mentioned about hyperemesis gravidarum that she experienced in the first trimester, it's a condition that most women will experience, where they have excessive nausea, excessive vomiting. They literally can't get anything down in terms of food and liquids. To sustain themselves. I mean, some degree of nausea and vomiting is acceptable in the first trimester of pregnancy, but not to the point where you can't actually tolerate anything. And when that happens, then you would need to be admitted, put up the drip like she was, and then, we'd need to basically give you a boost so that you can actually overcome that period and enter the second trimester where, usually it's more of a blissful time than the first. Okay.
Oh,
so I think she went through quite textbook style, to be honest.
Yeah, no, that is hectic. How soon after delivery can my body go back to normal?
Usually within a 6-week period, we expect the pregnancy effects to have subsided. By the pregnancy effects, I mean, in terms of the swelling that I mentioned should have gotten better. You should start noticing changes in your skin as well. But most of it is also dependent on how soon you become physically active. So the sooner you are physically active, the better your recuperation process goes overall as far as post-pregnancy is concerned. So we usually encourage mothers to, be as active as possible. When you're in the hospital immediately post your delivery, we try to get a physiotherapist just to help you with mobility and, getting your strength back and, your muscles to be active yet again. But the sooner you do that, the better your recovery goes overall. But obviously the recovery process is something that varies from woman to woman. And no two recoveries, like no two pregnancies, are the same. So each woman's recovery will unfortunately take different paths depending on how it is they themselves, they choose to handle it. But also the mode of delivery that you delivered your baby would sometimes also have a play in this. With women who delivered naturally, obviously having a much, let me say, quicker recovery compared to women who delivered via C-section, simply because a C-section is an operation, and you need longer time to recover from an operation than you do from a natural birth, where there's no anesthesia involved as such. Well, not like a C-section anyway. No anesthesia involved, and also there's no surgical cuts or wounds that you need to actually nurse in the postpartum period, because sometimes that can also hamper a bit how quickly your recovery overall is actually takes place.
Sure. Dr. Kofi, you definitely are enlightening us there as well. Come back. We'll discuss more issues around pregnancy. Dr. Kofi Kwaw-Asante, the obstetrician, gynecologist, and author of Pregnancy Related and Women's Health Centered Narrative.